Hello, this is Tracy Schroyer, and I am a breast cancer survivor, and I am providing some insight through my YouTube channel and the video series that I'm doing about my breast cancer experience and the journey that I've gone through. So, as of this video, I am actually backtracking. Sorry, the wind's really loud here. Backtracking and going back to a couple months ago to my first appointment with the plastic surgeon. So at this point, if you're following along in the video series, the number order, this would be just under a week. It was about 6 days after my appointment with my plastic surgeon. And I had an appointment in the afternoon with my plastic surgeon and went to talk to him about the options. And my breast surgeon had said to make sure that I share with him the options that I had and not be closed off to any one thing at this point, but to hear about how it would work and what the plastic surgeon said and the different, whether there are risks or challenges or, one thing might end up being better, whatnot. So being open-minded when I walked into that appointment, which I feel like I was. Uh, in my mind, I really wanted to walk in um, thinking um, that if I did um, so here were the two things that I thought of when I walked into this appointment is if I go with the lumpectomy and I do the radiation afterwards. With the lumpectomy, I would also do a breast reduction because I was very top heavy. So to do a reduction and to make them both very similar in what they look like and the shape and everything. And a lot of it depended too on how much was going to come out because they not only take the mass that you have, but also to get clear margins around, they take additional tissue around that. So there would be a hunk taken out of, or a big old chunk taken out of my breast. So being able to change that, do a kind of lift or reduce and that kind of thing. So to talk about that with him, but to also hear about if I was to go the route of doing a mastectomy, which in my case, I was looking at the double mastectomy, uh, would be the option that I would go with if I did that route. At the time, I didn't think that was the route I would go. Um, One of the things that I had in mind was I was so big in my chest that it made sense to me that couldn't they just use that excess skin? They would take some of it off, but use that and put the implants in. It's called direct implants during that surgery. So they do the mastectomy, remove as much. They can't always get all the breast tissue, and then do the implants and use the skin that they needed and stitch me back up, and I'm kind of good to go. So I thought for sure when I walked into that appointment that that could be an option. So I go into the appointment and I've never seen a plastic surgeon before. I didn't know what to expect. I knew I was probably going to have to disrobe just like all the other appointments I feel like I've been to, except for genetics. So I went into that appointment and first talked with him and a nurse. And he went through, like I told him, here's the options I was told by the surgeon. Here's like, what I'm thinking I'm going to go with. He brought in his laptop and showed me pictures of surgeries he's done. So he showed me, what did he show me? I can't remember if it was before and after, it was just the after, but he showed me not only lumpectomy with reduction, but also the mastectomy with the implants. So what would that look like? And kind of get an idea of if I'm not going to go back to the size that, I was at that time, what size am I looking to go to? So he can give me a good kind of visual of what that might look like. And at the time, he said um, he would be able to do, if I did a reduction, if I did the lumpectomy and the reduction, whenever you can keep your own skin, tissue, or take tissue from other parts of your body, if you had to, it would always look better than any surgery he did where he would have to do implants. So he's like, if your decision is purely on the looks of it and how everything looks, which mine wasn't, but I was concerned about that. Um, I'm not worried. I mean, I do have to look at them, every day, but also, for my husband's sake and things like that. So there was concern there, but that was not the primary concern. I'm not out flaunting in a bikini, so not worried about all that. So, and I did get to the question of, can you do a direct to an implant? And at that point, he said, let me look at you, let me measure you, and do all these sort of things. So he stepped out of the room. I put the robe on. He came back in with the aide or the nurse and started to do measurements of different things within my chest. And he looked at everything and he said, at that point, and I know this can be, excuse me, different in any scenario or situation, is that he would not be able to go that route, which at the moment and even afterwards pissed me off, to tell you the truth. I was just mad because I had that thought going in that if I did have to go that route of the double mastectomy, even at that point, I was waiting for the genetics to come back to help drive that decision, and that would not be, if I had to go that route, that I would have to do the tissue expanders and the reconstruction surgery later. So I was really frustrated about that. So he talked about, here's the two options that you have, based on what you're telling me, you're looking at doing the lumpectomy and the reduction, or the double mastectomy and the reconstruction with tissue expanders. And I was still really on the fence, and a lot of that driven by genetics. And I was still, so at that point, I was not even a week, and yeah, not even a few days really into having had done the genetics piece of it. So still had a long wait. So they said that that could take 2 to 3 weeks. So he said, you know what, we'll write up both scenarios. They'll fill out the form for it. And he said, well, you'll go to our scheduler, our office scheduler, and then she can go ahead and get your surgery scheduled if she doesn't already have it scheduled with the breast surgeon's office. And then once you have the decision, then we'll go from there as to, which route we're going to go. And I asked if I needed to see him again before the surgery took place. And he said, not unless you want to, because he knew the route that he would have to go. He wasn't going to do direct to implants, so he didn't need to know sizing or anything like that. He had already written down some notes of, what I was looking to be after. So he said, not unless I had concerns or wanted to. So I went back in the office to talk to a scheduler. And so she had not scheduled a surgery date with my breast surgeon's office yet, which I totally was fine with. I had only known at that point, it would have been 11 days that I even had breast cancer. So already, looking at the point of scheduling surgery and making that decision. But when she looked through everything and looked at the time that it would take him, so it takes the breast surgeon a certain amount of time to do what she needs to do, and the plastic surgeon a certain amount of time for what he needs to do. Well, in this case, it differed. So if I was doing the lumpectomy and the reduction, I believe that one takes longer. It would take more of his time to do that, whereas it would take less time to do the reconstruction with the tissue expanders. So basically, she had told me, she's like, you need to let me know once you decide which way you're going to go for us to actually put it on the books and schedule it, because of the difference in time that it would take. Which was another huge frustration to me, because I just wanted to get the surgery done, get it on the books, figure out what does the next couple months look like, all of that. So now I felt when I walked out of the plastic surgeon's office, like, here I am again. I just feel like waiting. So I'm waiting for the genetics to come back for me to make a decision. So frustrated, I kept going back and forth on, the different options that I have, and thinking through that, reading more things, starting to join at that time different private Facebook groups related to breast cancer, related to mastectomy, and people talking about lumpectomy, doing research, searches on that within those groups, and not really knowing at that point, what's the right decision. I felt, I don't know, I kept going back and forth, and I really, really struggled with it. So it was I want to say it was 3 days. Yeah, looking at my calendar, it was about 3 days after that appointment. And I reached out to the genetic counselor and I asked her if there was any update because she had even thought that she would have an expected date of when she would get the results, like have, like, when an order is coming or whatever. She did not even have that at that time. So, I went back and forth and thinking, and she's like, let me check on it and I'll call you back. So I want to say it was not even a day later of that afternoon that she said it could be another 2 weeks. Because at that point, it was maybe a week, a little over a week, and it was 2 to 3 weeks anyway. And so I had told her, I was open with her and said, they're not going to schedule a surgery for me until I decide what I'm going to do. And I feel like that decision is really based off of the genetics, the results of that. So I thought more and more of myself, and I was at work one day and sitting at my desk, and I just thought, I cannot sit here with this back and forth and dependency on this and having to wait another, possibly almost 2 weeks to figure out what I'm going to do, and then to go schedule a surgery that probably wouldn't even be for another month. It was just a lot of anxiety and frustration and just overall anger, even that I had to make this kind of decision and then I had to be going through this. And it's like, why the hell me? Why do I have to do this? So that whole victim mentality was creeping in. So what I did was I thought to myself, okay, if the genetic mutation, the genetic counseling comes back and I do have anything, I know the result that I would go is the double mastectomy. No question whatsoever. And I thought, you know what? I'm just going to do that. I'm not going to wait whether it comes back good or bad. I'm just going to go. I just had some people say they have like a peace within them. And it was just like, this is what I need to do. And so I remember I texted my husband and I said, I feel like this is the right way to go and to do the double mastectomy. He said, go for it, get it on the calendar. And I needed that piece too. So I called up my breast surgeon's office because they were taking the lead. And I said, I have made a decision. I'm not waiting for the genetic counseling to come back. Regardless, I'm going to do the double mastectomy. And the lady was amazing. And she said, let me get on the phone with the plastic surgeon and said that we can get a date worked out. So I thought at that time, I remember when I was talking to the office scheduler at the plastic surgeon and she was looking, and at that point she had said we wouldn't be able to do the last week of January, which in my mind I was thankful for, even though I didn't want to wait a lot longer. But I had already had a work trip planned to Chicago for the last week of January and already had set up, as long as that was still on, that I would be having dinner with quite a few different friends each of those nights that I was going to be in town, and just being able to see people in our office there and be part of the team. That meant a lot to me to be able to have that before I was going to go out of the office and not have that socialization and being able to, maintain things with work and all that kind of stuff. So I was fine with that. She said it would probably be within the first 2 weeks of February. So I had to wait. Actually, it was 2.5 days. And I kept calling the breast surgeon. They were probably thinking I was nuts, but I'm guessing they're used to it with different patients calling in and trying to get things moving. And I remember she called me back. It was a Friday afternoon. It was late afternoon. And she said, I didn't want you to go into the weekend not knowing this. And we have got a date for you. And February 13th, it was Thursday, February 13th is when your surgery will be. And they had already prepped me at my breast surgeon appointment in the beginning of January of what I would need to do prior to surgery. They gave me I don't know that it's antibacterial. It's some kind of soap you have to do the night before and the morning of surgery, wash with that. Already given me that, so kind of prepped me. I didn't have to go back and see the breast surgeon. The plastic surgeon said I didn't have to go back to him unless I had any concerns or questions we needed to talk through in person. So that Friday afternoon. Thankfully, I thank you so much to her for calling and letting me know that before I went into the weekend, because it would have been a crazy weekend for sure. So I had a date. I was ready to go, and I'll share more in the next video just about preparing for surgery and going into surgery. So thank you for watching.